I'm 64 years old and I'm married and I have 2 children and 2 grandchildren. I walk my dog, I work in my yard, I like to read. I think I started noticing about 2023. Didn't really know what it was. You kind of just explain things away, your heart kind of pounding a little bit in your chest and you think, oh, did I drink too much coffee? Was I doing some activity? And like, and it stops. So you just think, oh, it's nothing. It kept happening. So I thought, well, I better go to the doctor. So I made a doctor appointment. The cardiologist said that you should go see a doctor that specializes in AFib and the treatment of it. And then that's when I was referred to Dr. Payne.
She was having a reasonable amount of AFib, about 10% burden of atrial fibrillation. And this was despite medications to rate control her.
Dr. Payne also said that I was a good candidate for an AFib surgery called an ablation.
And so we talked about options for controlling her atrial fibrillation symptoms as best as possible. And she opted for an ablation.
He said, well, there's one other thing. We're going to want to use the pulse field ablation procedure.
Pulsed field ablation is a new type of ablation that uses a non-thermal energy. It basically uses a high voltage electrical field that renders that tissue irreversibly damaged. One of the advantages of pulse field ablation is less risk for certain types of complications, namely phrenic nerve injury and also injury to the esophagus.
It only seemed like it was a couple hours later and then I was back in my recovery room and wide awake and feeling great.
The procedure went extremely well. We were able to isolate all of her pulmonary veins. We did it in a time comparable to our previous ablations. She was discharged on the same day, and overall her experience was very, very good. She was more surprised at how quickly it went. Had no discomfort at all related to the ablation whatsoever.
I feel fine, and I don't feel any pain or anything in my chest. I feel normal. I'm still able to do my activities and do the things that I enjoy doing. So that's good, and I don't have to worry about, it's going to send me into an AFib episode. I would say that if someone's doctor is advising them to get a pulse field ablation procedure done for their AFib, that they should be confident in choosing that. I felt it works very well. I felt safe having it done. I felt confident that it would take care of the problem because it did mine.